As it turned out, parents are unaware of the early signs of potential cancer in their children. I will continue the topic of childhood cancer on my blog. Previously, I have already discussed the fundamental differences between the causes of cancer in adults and children and why the approach to treatment differs between adult and young oncology patients. According to a recent study, most adults are not confident in their ability to identify or even suspect early signs of cancer in children. Researchers from the University of Nottingham and Children's Cancer Charities surveyed 1,000 adults about how effectively they could recognize 42 classic signs of cancer in children. The results showed that, on average, participants, including parents, could recognize only 11 signs. Half of the respondents were unaware that lumps or swellings in the pelvis, breast, or testicles could be signs of cancer. Other recognized signs included blood in urine or stool, changes in moles, and weight loss. However, more subtle signs specific to childhood cancer were little known. Only 10% of adults were aware of the connection between early or late puberty and cancer, which is related to changes in hormone production that can be disrupted by tumors. Another subtle sign of cancer in children was developmental delays, such as the inability to walk or crawl at a certain age. Only 11% of adults were aware of this sign. Other subtle signs of cancer in children included slow recovery from bone injuries, such as a broken arm. The authors of the study emphasized the need for an awareness campaign about the signs of childhood cancer. They noted that public awareness could be key to early detection of cancer cases in children, when it is still treatable. Childhood cancer is the leading cause of death in children over 12 months old in the UK and the leading cause of disability among young people. Approximately 1,800 new cases of childhood cancer are diagnosed annually in the UK, with 250 resulting in death. However, it should be noted that many potential symptoms of cancer can also be caused by less serious conditions and illnesses. The authors of the study acknowledged that their research had some limitations, as volunteers might have provided answers they thought the researchers wanted, rather than reflecting their own knowledge. This could cause distortion of results and incomplete representation of the general population. A study based only on a sample from an older demographic group may not accurately reflect the opinions and behavior of young people. For reliable research results, it is necessary to consider different age groups and ensure a representative sample. In conclusion, I want to list all 42 signs suspicious for cancer in children and the percentage of respondents who were aware of this sign. Swelling, lump in the pelvis, groin, testicle, or breast, 46%. Blood in urine or stool, 44%. Changes in moles, 43%. Lump, swelling in the chest wall or underarms, 41%. Weight loss, 40%. Abdominal swelling, mass, 38%. Lump, swelling on the face, jaw, and skull, 36%. Persistent, recurrent headache, 32%. Persistent, periodic fatigue or tiredness, 32%. Loss of appetite, 31%. Persistent vomiting, 31%. Excessive bleeding, bruising, rash, petechiae, type of rash, 30%. Seizures or fits involving loss of consciousness, 29%. Pain in the chest wall or underarms, 29%. Unexplained bone or joint swelling, 27%. Change in bowel habits, constipation or diarrhea, 27%. Persistent, recurrent, progressive abdominal pain or discomfort, 26%. Difficulty urinating, 26%. Vision problems, 26%. Swollen glands, 26%. Deterioration of balance, walking, and speech, 23%. Persistent, recurrent bone or joint pain worsening at night, 23%. Noticeable skin paleness, 22%. Multiple infections or flu-like symptoms, 22%. Unexplained bleeding after sex and between periods, 22%. Fever and night sweats, 21%. Shortness of breath, 21%. Difficulty swallowing, 21%. Unexplained limping or weakness, 20%. Persistent, periodic unexplained crying in young children, 19%. Persistent, recurrent sore throat or hoarse voice, 18%. Torticollis, head tilt or neck stiffness. In young children, 18%. Leukocoria, white glow of the pupil instead of the usual red, also detected in photos taken with a flash, 18%. Hearing loss, 17%. Abnormal eye movements, 17%. Abnormal facial movements, 16%. Persistent ear pain, 16%. Limited mouth opening, 14%. Slow recovery from bone or joint injury, 14%. Slow growth, 13%. Developmental delay in children under 2 years old, 11%. Early or late puberty, 10%.